Hi, my name is Teresa Morales. I'm a Master of Nursing student at Athabasca University. Welcome to my virtual lunch with Dr. Dean Watson, one of the most influential theories in modern nursing. Today, I will explore how Watson's theory of human caring can be applied to a real life nursing scenario in my role as a registered nurse supervisor in long term care. According to Pajkihar et al. 2017, Jean Watson's theory of human caring emphasizes the importance of a transpersonal relationship between nurse and patient. It is not just about treating illnesses, it is about creating healing environments where emotional and spiritual well being are as important as physical care. The theory's focus on the interconnectedness of mind, body, and spirit aligns with my philosophy of holistic patient centered care. I've chosen a peaceful cafe for this discussion because it mirrors the calm, nurturing environment that Watson's duty encourages us to create for our patients. As a nurse supervisor in long term care, I often work with residents who are facing anxiety and distress due to chronic illness and aging. One particular scenario I'm reflecting on is a resident, Mrs. Smith, name change for privacy, who struggles with loneliness and fear about her declining health. She requires not only physical care, but emotional reassurance and a sense of purpose. Now, I'm going to imagine myself in a quiet cafe asking questions to Dr. Watson, and my first question is: Dr. Watson, your theory highlights the importance of transpersonal caring. How would you suggest I create a deeper emotional connection with Mrs. Smith to help her overcome her sense of isolation and fear? I ask this because establishing a caring connection is essential in long term care, where residents often feel disconnected from their loved ones and the world around them. My second question is: one of your key concepts is the caring moment, a unique interaction that fosters healing. In Mrs. Smith's case, how can I identify and create more of these moments in my daily routine, considering the demands of managing a busy care unit? I'm asking this to understand how I can better balance the technical demands of nursing with the emotional and spiritual needs of residents. My third question is: your theory promotes holistic care, which includes mind, body, and spirit. In a clinical setting focused primarily on physical health, how can I advocate for a more holistic approach without facing resistance from colleagues who may prioritize efficiency and clinical outcomes over emotional care? I'm asking this to address the challenges of integrating holistic practices in environments that prioritize efficiency and data driven care. My fourth question is: there are moments when our residents need quick medical interventions and the emotional connection takes a back seat. How do I balance the urgent physical care needs with the emotional and spiritual support emphasized in your theory? This is important because I want to understand how to apply Watson's theory in fast paced, task oriented settings where the focus is on physical care. Finally, your theory focuses heavily on emotional intelligence and empathy. What strategies would you suggest for fostering these qualities in my nursing team to ensure that we all deliver care that aligns with the principles of your theory? As a nurse supervisor, I want to ensure that my entire team embraces the principles of human caring to create a culture of empathy, not just in my own practice but across the facility. Through this conversation, I've gained valuable insights into how Watson's theory of human caring can be applied to my work as a nurse supervisor. I now have a deeper understanding of how to connect emotionally with my residents, foster moments of healing, and advocate for a more holistic approach to care in a setting that often prioritizes efficiency. Thank you, Dr. Watson, for sharing your wisdom. That is it for my presentation. Thank you very much for listening.